Alright, so today my patient has a tracheostomy, so it's going to need a tracheostomy care, and it's going to need we're going to need to suction a little bit. So before I go in, before this procedure, I want to make sure that I hyperoxygenated my patient, and I also have a pulse oximeter nearby to put on her so I can make sure that she does not dip below a certain saturation level. And I also did a thorough respiratory assessment and determined that she needs suctioning. Okay, so I'm gonna put I'm gonna give privacy, and I'm gonna do hand hygiene. I'm gonna put that. Hi there, I'm gonna be your nurse. My name is Sin. We're gonna do a trach care. Can I have your name and date of birth, please?
Okay.
Perfect. I want my patient to be kind of at a semi-forward position while I'm doing this. So beforehand, let's make sure we hyperoxygenate. Okay, so she's at a pretty good, she's at 95 to 100, so we can put this aside. And then I'm going to also check that suction is working. Good. I'm going to keep this nearby, and I'm going to put on a mask while I'm doing this procedure. Okay, let's start with suctioning. So these are all in a sterile kit, so I'm opening it for the first time. And then I also cleaned my table. Again, this is all in a kit. And so I'm going to open, I did hand hygiene, by the way. Before. Okay. This hand. Okay. Oh, these are all sterile. Okay. So, wait. I guess I can just open this right now. Okay, these are all sterile, so I'm gonna open with a sterile glove. Okay, and then, oops. Okay, well, without one of the sterile gloves, I'm gonna have somebody help me pour this in here. And then, all right, so these are still sterile. I'm gonna grab this guy. And, all right. Now this is no longer sterile. I'm going to put this, and with this hand I'm going to turn it on to somewhere between 90 to 100. Sorry, 80 to 100. So I want to do maybe around 90. Alright. And with this hand I'm going to control this. Okay, good. It works. Alright, now I'm going to go in all the way until I feel resistance. And as I'm withdrawing it, I'm going to turn it, rotate it, and start suctioning. Okay, and then so I'm going to do that for only about 10 to 20 seconds. I don't want to be in there for longer than that. And I'm going to have a coworker hyperoxygenate the patient in between each pass with an ambibag. Still keeping an eye on the pulse oximeter, and I'm going to wait also about 2 to 3 minutes before the next pass. So I'm going to do a couple more times. All right, so that's done. That up. Okay. throw these away. Okay, now I'm gonna do a dressing change around her trach. So I'm gonna do this. When I open this, I'm gonna put this.
And then I'll just wash it.
Hand hygiene. Alright, so, okay, now let me move the dry ones that should stay dry in here. This can get wet, a couple of these can get wet. Pour it in here. Okay. I think now I'm good.
Yeah, I'm gonna trash it.
Yeah. I think now I'm gonna put on the.
I don't need it. I'm gonna wash my hands. I have my normal saline solution there.
Okay, we're gonna yeah, take that one off. Inner cannula off and leave it in here for it to soak in the solution. And then I'm going to use these to clean some crusties around. Use this to also clean around. All right. Now I'm going to clean this, and depends on the policy. Probably I'm going to throw it away and get a new one instead of reusing this one. But for the purpose of the video, we're gonna clean and dry it, and then we're gonna put it on. We also want to make sure that with the dry gauze we dry it before we do anything else. Okay, now I'm gonna put the new this drape over. Oops. And I'm gonna make sure I'm not moving this at all. Stabilizing this in place. Putting the new strap before I take the old one off. For this one, I can lower the bed a little bit. So I have her chin lifted up. And then I'm gonna remove the old one. Somebody knotted this, so we're just gonna pretend that I removed it off. Put this back on, make sure that her oxygens are still good. Clean up, clean everything else up, and document my findings and how much suction came out, and then I'm done.